is plastic surgery before and after. When 76-year-old Trini Campbell looks back on her life, it's almost as if she's recalling a different person.
They said you look like Hedy Lamarr.
Yeah, they say that.
Singer, songwriter, guitar player, Trini was a well-known entertainer in her hometown of Guadalajara, Mexico. Later, she married, moved to Texas, and had 4 children. But at 46 years old, Trini's life was turned upside down when she was diagnosed with a brain tumor.
I could see myself in the casket right away. I thought, oh, my children, I'm going to die.
Fortunately, Trini survived the invasive surgery that removed the tumor, but it left her with disfiguring paralysis on the right side of her face. It also damaged her vocal cords, giving her a soft, raspy voice. The nerve damage is permanent. For 30 years, Trini never dreamed that anything could repair her uneven appearance. But last year, when her daughter Eva moved to Los Angeles, they learned about a unique plastic surgeon. Dr. Azizzadeh specializes in reconstructive surgery for facial paralysis.
Fortunately, there aren't a lot of centers around the country that perform these operations. One of the ways that I think we've been very successful with patients in your age group and even younger have been to do what we call a facelift procedure to really improve the appearance, make the patients look younger, and that, in a roundabout way, takes the attention away from the facial paralysis. While we're doing the facelift, we're going to be able to suspend this area and create that tightness and a little bit more balance between the two sides. Okay.
Dr. Azizzadeh brings in his colleague, Dr. David Alessi, to improve the effects of Trini's vocal cord paralysis.
Look at your...
The vocal cord on the right side is moving very, very well. The one on the left side isn't. And so we're going to take this vocal cord here and move it more towards the middle. That'll help give you a stronger voice and also to decrease the chances of liquid going down your vocal cords the wrong way. So I'm pretty sure we'll be able to help you.
Ready to go?
Trini's big day of surgery is here. Today, she hopes to reclaim her face by undergoing eyelid surgery, a static sling suspension, a facelift, and fat grafting in her vocal cords. Trini is put under general anesthesia. The team prepares for the next stage of the operation. Dr. Azizzadeh makes an incision along Trini's thigh to harvest a thick layer of tissue called fascia.
That's very, very hardy. We're going to use that to suspend the face and the lip.
At the same time, Dr. David Alessi begins his part of the operation by inserting a laryngoscope into Trini's mouth. This instrument will allow him to view and operate on her paralyzed vocal cord.
So if these vocal cords are here, I'm now cutting over here to make a opening in the vocal cord so I can put fascia in there to make the thing move over.
Dr. Alessi uses a tiny piece of the fascia that was removed from the thigh to augment the paralyzed vocal cord.
I basically just tuck fascia in there. What it does, it moves the vocal cord over more to the middle, so when she speaks, she won't have as much air coming through. She'll still have a little bit of air, but still should have a better voice than she did before.
Next, Dr. Azizzadeh begins the facelift on Trini's paralyzed side. He cuts around the ear and dissects through the skin.
So that's the fascia that we harvested. This is where we're going to do that static sling. We're going to sew it along this area where I've marked. Now we're going to go to the left side and do the left side of facelift. The technique is going to be different because we're not using that static suspension. So this side is going to be very similar to just a standard facelift procedure.
3 months after undergoing 4 cutting-edge procedures, Trini returns for a checkup with Dr. Azizzadeh.
Good to see you. The incisions have healed beautifully.
Yeah.
So you got nice movement, nice symmetry. Yeah. This is pretty good.
Dr. Azizzadeh appears pleased with the results of the facelift and the static sling.